Thank you for that. And to start off, I'd just like to quickly acknowledge my co-authors, Carolyn Murray, Angela Byrne, and Jacinta Robinson. Workplaces are not the area that people traditionally think of dementia, but with the changes in our society, we're starting to see an older workforce with the population ageing, changes to the age of retirement that it's happening internationally, and greater participation of older people in the workforce. And so we're starting to see older people, workers continue to older ages in the workplace, and so getting into the ages where dementia could develop. Sitting beside that, of course, is the younger people who develop dementia, and quite often with that population, they are still working when the dementia starts to develop. The research about dementia in workers is quite limited, and so we did have to look at the grey literature to get a lot of our information. The impact of dementia for the worker includes such things as they become forgetful, easily distracted, and poor concentration. They start to miss appointments, forget meetings. They have difficulties with planning their days and with time management, become fatigued, have difficulty learning new materials, become increasingly slow. One of the people I spoke to developed dementia at work. After he left work, his wife went back and spoke to his manager and said, "Didn't you notice anything? Didn't you notice things were wrong at work?" And the manager said, he did everything he was meant to do, he just did it very slowly. People start to have problems with decision making and problem solving. They talk about feeling overwhelmed with deadlines and busy times. And the standard of the work starts to decline and they make mistakes. And certainly talking to people, all of these events as they develop in the workplace give the impression of a worker who's distracted, who's not really interested in work and is a poor worker. And so quite often people, while they're developing the symptoms of dementia, start to be considered a bad worker and start to get treated poorly well before they have a diagnosis to make sense of all of the changes that are happening in their life. In terms of workplaces, when a worker develops dementia, they're very poorly equipped to manage the situation. Dementia is unexpected and unfamiliar. Then there's no routines and policies about what to do, how to support a worker, what's expected of them. Quite often they're uncomfortable even talking about the dementia. It's common to have very stereotypical views about the person with dementia. Assumptions that the person will stop work immediately. That seems to be an assumption sometimes that the person with dementia also has too. And so there's very little attempt to support a person in the workplace if everyone's assuming that they will stop at work immediately. There's limited information about how to modify the workplace. And so any workplaces that do want to support one of their workers who has dementia, there's very little guidance, and so they have to develop the strategies and support themselves. And some people who do develop dementia while they are working report negative workplace experiences. And certainly that was my link into the topic in the first place, the negative experiences that people had at work, treated poorly, lack of support, people stepping back and not supporting them. In terms of actually practical strategies to support a person at work, the information is very limited in the literature. And so we did look a lot of the grey literature for suggestions and advice for people who have dementia. And one of the first areas of advice is about assessing the situation and seeking advice. one of the issues raised is that people do make hasty decisions and resign, and in that they miss a lot of their benefits they could be entitled to, the sickness benefits. So the first suggestion that we identified was about pausing and assessing the situation, seeking advice from a range of different people, health workers, and also counsellors and the workplace. The next area was about telling people about the dementia, and the literature advises a little bit of caution here, and the person pausing before they do it and thinking about who they will tell, and that they may need a support person with them when they talk to the manager. Workplace support is broadly about dementia-friendly workplaces that have policies in place to support people with dementia and are comfortable to talk about the dementia and what it means for the worker and their continued employment. Reasonable adjustment of work duties. There's a lot of suggestions in the literature about this, not evaluated, and so how useful they are, it's a little bit difficult to determine, but there's a whole range of different ways that workplaces can modify and adjust the work. Look at reducing the duties of the person, giving them a simplified routine, moving them to a quieter location, and also having buddy systems to assist them in the workplace. And the final area was about leaving work and encouraging people to have a little bit of think about how that is going to happen, talking to the family, talking to the workplace, to look at decisions about when the time to leave. We looked for information about rehabilitation in the context of employment, and there's very little around about that, and the rehabilitation for workers with dementia is a relatively new concept. It's certainly one that has not had a lot of thought about. So we looked for guidelines and ideas about how to think about it, and the WHO define rehabilitation as a cyclic process. It starts with identify the problems, the needs, relate problems to modifiable and limiting factors, define the target problems and target mediators, and select appropriate methods, plan, implement and coordinate interventions and assess its effects. And so we looked at that and tried to relate it to the context of the person working with dementia. And in the chapter, we created a framework for vocational rehabilitation for the worker with dementia that was informed by the WHO's 5-step rehabilitation process. We also used the International Classification of Disability, Functioning and Health, the ICF checklist. And finally, we used some of the strategies that we found in the workplace, the practical strategies that people can do to help them continue to work for as long as possible. And after our investigation of the literature, looking at the rehabilitation frameworks, we concluded that there is a free-phase vocational rehabilitation continuum that can be used for people with dementia at work. And we propose that framework is assessing the situation and telling people following the diagnosis of dementia, reasonable adjustment and workplace support, and then planning the transition to new participatory roles and leaving work. And I guess that's the difference from normal rehabilitation. It wasn't returning the worker to the previous function. It was about supporting them into transitioning out of work to other activities and other roles. Thank you.